Hello, my name is Curtis Henderson and this is my anti-drunk driving campaign. First thing we would need to know is understand the purpose of why I'm putting this on. So understand the different effects alcohol has on your body and how it affects aggression, driving, violence, and then at the end of it we'll talk about some treatment options. So effects of alcohol on your brain. As most of us know, alcohol is a CNS depressant drug. A lot of people think it stimulates you, but it's not the case. As we see in the next couple slides, we'll see the different parts of the brain that alcohol affects. So our cerebral cortex, this is where our senses are. When alcohol affects that portion of the brain, that's how we become more talkative. Our frontal lobe, that's where we do most of our planning and forming ideas. Alcohol affects these differently as well. Controls emotions, controls urges. Our cerebellum, coordination. We've all seen that one person who is drunk and how they're stumbling all over. They're all over videos of YouTube on that. The hippocampus, this is where our memories are made. When a lot of people drink a lot of alcohol, you notice they don't remember what happened the night before and they're asking a friend, what happened to me? Well, alcohol reached this part of the brain, and that's why you have trouble remembering. The hypothalamus, this is where a lot of our housekeeping chores, blood pressure, heart rate, hunger, all that is regulated. Also, our body temperature and heart rate decreases when alcohol affects this part of the brain. The medulla oblongata, this body's automatic actions, the heartbeat, respiratory rate, thermal regulation, drinking, outside of the body can cause outside could cause hypothermia. A lot of people say drink a beer to warm you up. That's not the case. So that's just a quick rundown on different parts of the brain that alcohol affects and how it affects you. Some physiological effects of alcohol. We have toxic reactions, talking about how much alcohol is in our blood alcohol content, concentration in our blood. The more alcohol, the more problems we're going to have that goes through our blood. As it states in the slide here, a 165-pound man needs to have consumed 23 drinks over a 44-hour period to reach a blood alcohol over 0.50, which is the deadly dose. Heat loss, as we went over in different parts of the brain, alcohol is a perpetual vasodilator, or peripheral vasodilator. That means our blood vessels are expanding, opening up, more blood flow is going through, blood pressure decreases, that more heat escapes. Diuretic effects, we've all been there before. You drink too many beers, you're constantly in the bathroom. Other effects can cause swollen fingers, hands, and feet. Effects on our sleep. A lot of people get drunk and pass out, but they're not getting the appropriate kind of sleep. It affects your rapid eye movement portion of your sleep. That's where our dreaming states are. As a result, individuals sleep poorly and experience nightmares. The effects on pregnancy, we're always preached about how don't drink while you're pregnant, and that's the case. Don't do that. It has potential of causing retardation and development of the fetus, cause fetal alcohol syndrome. Tolerance and withdrawal. The brain is less responsive to alcohol's depressive effects. Therefore, if the level of alcohol consumption remains steady, individuals feel less of the effect. That means the more you drink, the more years you're drinking. You could drink 6 beers the first time you drink and be absolutely smashed. By your 10 years into your drinking career, that 6 beers is like taking a sip of water. It's not going to do anything with you. Withdrawal begins with insomnia, vivid dreaming, and severe hangovers. These effects can then lead to the shakes, sweating, mild agitation, anxiety, nausea, and vomiting, as well as an increased heart rate and blood pressure. Chronic effects can cause liver disease. There's 3 different forms that we could get from the alcohol consumption. We can get fatty liver, alcoholic hepatitis, and liver psoriasis, and that's involving scarring and deterioration of the liver cells. Cardiovascular problems, you get fatty accumulations in the heart and arteries, high blood pressure, and that could lead to a stroke, irregular heart contractions, poor blood circulation to the heart, which will cause a heart attack. Cancer. Alcohol is not technically considered a carcinogen. It is possible that the increased risk is combined result of alcohol enhancing the carcinogen's effects of other chemicals that we have in our body. Now we're going to move on to the impact of alcohol upon violence, aggression, and driving. So direct effects of alcohol. Alcohol may encourage aggression or violence by disrupting normal brain function. According to the disinhibition hypothesis, for example, alcohol weakens brain mechanisms that normally restrain impulsive behaviors, including inappropriate aggression. By impairing formation processing, alcohol can lead to a person to misjudge social cues. That is meaning you see somebody across the street after you've had a long night of drinking and they're waving at you, but your brain is misinterpreting it as they're throwing a threatening gesture at you. They could be flipping you the bird, perhaps, and that's what you're thinking, and it causes some form of aggression. So when we get into it, these are some impacts that can happen. Homicide, as you can see the statistics, 40% of convicted murderers have used alcohols before or during the crime. Go through robbery, sexual assault, child abuse, aggravated assault, and then the intimate partner violence. So this affects a lot of different people, not just the person committing the crime. All of these victims with each of these cases. A number of individuals that serve time in jail have committed alcohol-related crimes. Offenses range from minors to serious and include property crime all the way up to homicide. So here's some impacts of driving while intoxicated for victims and participants in drinking and driving. And this is all from the CDC. In 2015, 10,265 people died in alcohol-impaired driving crashes. Those are a lot of innocent victims that died in that. Injuries go skyrocket. You can see over 2 million were injured a year from motor vehicle crashes involving impaired driving. And then arrests. You can see how much money that's costing the American people. 1.1 million drivers were arrested for driving under the influence of alcohol or narcotics. That's 1% of the 111 million self-reported episodes of alcohol-impaired driving. So now we're going to move into some alcohol treatment options. First one that is out there for us. There's other ones besides these three, but I found these three to be the most effective, most commonly used. So we have biologically based treatments. This includes medications that prescribed to people trying to stop drinking. Then we have Alcohol Anonymous. AA functions as a type of group therapy. This is where alcoholics meet once a night, once a week, however many it takes. They talk about their problems that they've had with drinking. Smart Recovery is a treatment program for the abuse of alcohol and other drugs that emphasize a non-spiritual philosophy. So it's a little different from AA. AA, people believe God's there to help them. Smart Recovery is self-management and recovery training. That means they manage their recovery. It's not a higher power helping them, it's them personally fixing it. And then the references where I got all my material from. I hope this helps out with somebody. I hope it reaches somebody out there and shows some sort of effects that this could happen to me if I drink and drive. It's not just you affected. You can affect 10, 15, 20 other people out there, maybe even more, for a lifetime. So please don't drink and drive. Thank you.